Precision Neuromuscular Therapy has been teaching high-quality seminars for over 20 years across the country. Founded by Doug Nelson, PNMT uses problem-solving skills and precise treatment options to get powerful results for your clients. PNMT seminars focus on honing your assessment and palpation skills to precisely target the source of your client's pain while understanding the why behind the what. Meet us in a hands-on seminar or online in the PNMT portal and let us join you on your learning journey. Learn more at pnmt.org. At Heights Retreats, massage therapists build stable and meaningful careers rooted in wellness and care. A place where therapists are dedicated to delivering exceptional care to the guests, not to filling their schedule. Heights Retreats care deeply about their therapists, our profession, and wellness itself. Grow with Heights as they evolve into a wellness-driven future. Visit heightswellnessretreat.com for more information.
Dear, I have a client who, listeners, I'm doing something with this episode that I have not done before, which is offering you an interview in 2 parts. I had the remarkable opportunity to interview Dr. Chris Callewaert from Ghent, Belgium, who goes by the name Dr. Armpit, all about issues related to armpit odor, foot odor, the skin-gut axis, and so much more. So be sure to listen to both episodes. And now I am very happy to welcome Dr. Chris Callewaert, Dr. Armpit. Listeners, I'm so excited to bring you a special guest today. My social media home of choice is Threads, where there's a very interesting community in a lot of my special interests, including medicine and things around human health sciences. And it was in this context that I encountered a person calling himself Dr. Armpit. And in reading his posts and a little bit about his background, I realized Dr. Armpit, who was also Dr. Callewaert, yes? Okay, good.
Correct. Yeah.
Was willing to meet with me to record a podcast about his explorations of the world of body odor, because this is so relevant to the work that we do. And I was so pleased when he said yes to this invitation, especially considering that he is coming to us. Are you in Ghent?
In Ghent, in Belgium. Yeah.
Yes, in Ghent, in Belgium. So there's been a time change as well. So Dr. Callewaert, thank you so much for being with us here. And can you tell us a little bit about why you call yourself Dr. Armpit?
My pleasure to be here. Actually, my colleagues started calling me but Dr. Armpits because I was the guy in the lab. We were like 100 researchers in the lab, and I was swabbing everybody's armpits. I'm like, what is this guy doing, swabbing armpits? And he's pursuing a PhD, pursuing his doctorate. He wants to be Dr. Armpits. And I was literally just, my first research paper was really, what is living in the armpits? What bacteria do we have? What's going on there? So that was really just characterizing what is going on in the armpit. Which bacteria strains do we have there? That was my very first research, and actually all my colleagues helped because I took samples from everybody, including the professor emeritus that went on emeritate already. Everybody, also my friends, went playing pickleball or squash, how you call it here. Before and after I swapped around, I swapped everybody essentially. My friends, my family, myself. I swap myself almost every week to follow up what's going on. So yeah, I have a very keen interest in armpits and also related to body odor development. My goal has always been to solve body odor, and that's still what I stand for.
That's an amazing calling.
Yeah, it really is a calling.
Very, very relevant to the work that we do. Do you work with patients, or are you basically in the lab at this point, or both?
So I was always in the lab. but I see more and more people. So I'm not like a medical doctor. I didn't train in medical field, but by now, I mean, I've done so many. I know a lot about the medical field, of course, as well. But I'm not trained as a medical doctor, so I should not be seeing patients. But having body odor is not a medical disease. It's not a condition. It's not a skin disease. It's really more cosmetic, so to say, and it's really not. There's no field that in medicine that deals with body odor, so to say. So it's really more on the cosmetic side. While I would argue that body odor is really bothersome. We also analyzed the psychology of body odor, and it's in the range of having acne. It's a range of having psoriasis or eczema. It's really bothersome. It affects people. It to the point even where people don't even dare to go out anymore. They're afraid of their colleagues, of what people might say about them. Probably more in professional environments, in environments where they don't know people. They're really bothered by it, and they want to find they're after solutions, and the solutions are not quite there yet. So there's still a lot to do. And if they go to a doctor, to a medical doctor, then they say, well, just use deodorant, you'll be fine. It's not that bad. But the thing is, they see that person maybe 15 minutes, maximum half an hour. It's not that fine if you see that person 15 minutes or half an hour, but that person has that odor, even if it's just a little bit, day in, day out, in the morning, midday, every single day they have it. And it's something. We also know that objectively it might not be that bad, but subjectively it really starts to accumulate, and it's really, it really follows you everywhere you go. Where if you go to bed, if you get up, it's really always there. And people that have body odor are really much more hygienic than people that do not have body odor. So it's really it's not a matter of hygiene either.
It's a matter of self-image. In the same way that something like eczema or psoriasis are a matter of self-image. And, speaking for my group, my population, this is going to prevent someone from seeking massage because they are so self-conscious about this. And that, of course, becomes a self-fulfilling prophecy because you get nervous about a thing happening and then it happens and then it's worse. So we've been using this term body odor as something negative and something that people are often self-conscious about. But I'm kind of curious about how we define the difference between a good or healthy body odor and a bad one. Is there an objective line, or is that really a matter of subjective taste?
So odor by default is subjective, right? How we resolve it is working with an odor panel with multiple different people, mostly 4 men, 4 females, and then we average it out, and then we combine all those results, and then we have more objective value for odor, for body odor. We developed, in essence, a bit of our own scale. So we have a scale to rate beer, to rate wine. You have a scale for flowers, for blossoms, But I really took the one from wine, and then there were already some things on odor described. Of course, you had the sour, the musty, the oniony, But there's also good scents. Basically, there's also buttery, which is not necessarily bad. There's also floral. Armpits can smell a bit sweet and floral. Armpits can smell like mushrooms a bit. Armpits can smell a bit earthy. So there's actually also a range of positive odors associated as well. On the negative side, you have sour, you have oniony, you have musty, you have even fecal-like. So there's negative body odors, but there's definitely also positive and positive good body odors. I have smelled armpits which actually generally smell good. Armpits can actually smell pretty good. It doesn't by default have to smell bad. But our life and our society or our lifestyle, so to say, has led us to have more negative body odor, have more unpleasant body odor. And that is very much linked to the internal body as well, to the internal system. So to the gut and to overall health in general. So actually, armpits can tell a lot about your health, about your age even, can tell about reproductive status, about stress, about hormones. Armpits, reveal a lot of information, whether we want it or not. And most of us, we know, okay, when we're stressed, we smell, and if you give a presentation, you don't want to smell bad. So in this society, we want to mask a lot of the body odor away. Understandable. But in essence, if you're perfectly happy and healthy, you will not have any bad body odor. You will have a good microbiome, you have a good sweat profile, and that combines will, you don't even have to wash your armpits. If you're perfectly okay, then you do not smell at all. So yeah.
I may take this out again later because it's a bit of a detour, but a couple of the descriptions that you had of positive body odors, a little sweet, you said, and one was a little mushroomy. To me, that makes me think about diabetes and about fungal infections. So,
Okay.
and so I would interpret that if someone's body odor, and particularly if their breath smells sweet, that there is something problematic about this person's blood sugar.
So there's indeed a lot of cues for that are body odors are linked to specific conditions. And one very famous one is if your breath smells sweet, if you have a specific sweet scent to it, if your pee smells sweet,
right,
then it's oftentimes links to diabetes or pre-diabetes or early diabetes or type 1 or 2 diabetes. Having a too high blood sugar levels in the blood in the system, which is of course dangerous, not for once, but in long term it can be very dangerous. So indeed, the sugars are not metabolized in the right way in the body, and the body basically emits sugars through fecal material, through urine, but also through sweat, and even through the lungs. Those sweet molecules will also be emitted there. So actually, yeah, you're completely right. People with diabetes will have a scent which is more sweet, also a bit more metallic acetone notes in. Yeah, you can very much tell apart people that have diabetes.
So I want to go from that to a question that speaks to my own educational history. I'm fond of saying way back when I went to massage school, which is likely before you were born, I was taught that the skin can be recruited as an organ of excretion, as a mechanism of getting rid of metabolic wastes. We called them toxins. Toxins is in my community, the word toxin is a little bit of a trigger word, but metabolic wastes. But that it's not really designed for that. It's not good at it. And typically, if we find ourselves excreting sugar or other materials that don't belong in us, typically this is an indicator that our normal organs of excretion, right, liver, kidneys, lungs, are not doing their job. Would you say that that's an accurate interpretation?
Yes. Well, the thing is, I would also say, whatever is in your system, it will also emit. It will emit through urine, through fecal material, but also through skin. So it runs through your blood circulation and through lip circulation. And, sweat is one way to basically emit certain molecules which are in the blood and in the lymph canals, essentially. Most of it will be, goes through the liver and through the kidneys and through, our organs that will filter things out. But if it's in our body, if it's in our blood, if it's in our lymph canals, it will basically also emit through the skin, and definitely through armpits. Basically, armpits, that's a concentrated location where a lot of eccrine sweat, also sebum sweat, but also apocrine sweat is emitted, and it's a very important location to pick any sense up, essentially. Yeah.
All right. Well, that's a refinement that I will build into my teaching. Right. So one of the themes that we have kept coming back to is that bad smelling sweat, body odor, is an indicator of a more complicated relationship in the microbiomes in the body. Yes. And so if someone has persistently bad body odor, we can talk about not having adequate diversity and having some of the bad bacteria sort of taking precedence. Can you talk a little bit about how that biodiversity in the armpit speaks to what's happening in the gut in particular?
There is a big skin-gut axis. There's a couple of things. So basically, your gut produces a lot of hormones. It's actually the biggest hormone producer of the body, bigger than the lymph nodes, than the androgens. So the gut microbiome produces a lot of hormones, happiness hormones. So if you eat a good meal, you'll feel satisfied, you feel happy, right? You'll have good hormones. But if you ate something, in my case, if I would drink milk or like young cheese, my gut would start to bubble, and I would feel uncomfortable, and that releases stress hormones and cortisol and maybe adrenaline. Or if I drink a lot of coffee, I would get adrenaline, and that makes me nervous, and that will also impact stress hormones. So basically, you have good hormones, bad hormones, stress hormones, happiness hormones. They determine how we feel, they determine who we are, and determine the stress that we have, the levels that we have, the amount of work that we can do with us. A little bit of stress is okay. Too much is not, certainly if it's chronically. So what is your gut health is super important for also the body and definitely also the armpits. When the gut is stressed and when for instance, the mucus layer is thin, or when the fermentation starts too high, essentially, then that impacts the rest of the body, and that can also reflect in body odor. It can also reflect, for instance, in eczema. It can reflect in certain skin conditions. It can reflect in acne, but it can also reflect in body odor. So we've seen in our studies, we've seen that body odor is worse for people that consume more fast foods. It's worse for people that consume more red meats. And it's worse for people that consume little to no vegetables. So those things were significant results that we found. There's also other correlations that were not necessarily significant, or we couldn't tease it apart. But there's other foodstuffs that also heavily impact our gut health, which also influence underarm body odor. So the gut skin axis is super important. We've seen it time after time in the underarm. And I do see patients, I see body odor, people with body odor. And that's always one big topic that I discuss. What do you consume? Do you have any gut issues? Is there something going on in the gut? I want to know what the problem is. Like 2 hours ago, I had a call with this lady, and she had a bit of a white tongue. It should look like a bit of a strawberry. It should not be looking white all the time. But a lot of people have this white tongue, and they just brush it, and they don't think much of it. They have a morning breath and anything, but it's not normal to have a morning breath. It's not normal to have this white tongue. If you have a white tongue, it can be a sign of SIBO, of small intestinal bacterial overgrowth. Basically, the fermentation starts too high, so we already have biofilms in the tongue, let alone in the stomach. There will be certain bacteria, and basically in the upper digestion part, you will also have more bacteria than you should have. So basically, fermentation starts too high. Mm-hmm. And that really impacts your whole human being. That impacts hormonal. You feel stressed, or you basically never notice you grow up with it. But it's really something to be careful to look out for. Having a white tongue or having SIBO can also be a sign for body odor, or body odor can be a sign for SIBO. Can definitely be linked. So basically, the gut and the armpits really are closely tied. There's a lot that can be revealed from the gut.
This is a good moment to break our conversation into the first and second parts. In part 2, which will be the next episode of I Have a Client Who, Pathology Conversations with Ruth Werner, I'll continue this discussion with Dr. Callewaert, and we'll start with a description of his time working with a tribe of people who don't have body odor, and some thoughts about what makes that possible. We'll also dive into the quite complicated issue of foot odor. We'll talk a little bit about ways that work and don't work to tell people that their body odor may be an actual problem for them. And Then we'll wrap up just with a review of the fact that body odor really changes people's perception of themselves and their self-esteem, and how we're in a position to be supportive and non-judgmental there. Plus, of course, a discussion of follow-up resources if you would like to pursue Dr. Armpit's work further. I will hope to see you there.
Elevate your bodywork career with Anatomy Train's Structural Integration Certification, ATSI. Discover how to map the pattern and shape the change through inspiring lectures, hands-on body reading, and practical techniques you can use in your practice right away. Join us for ATSI Maine 2026 to 2027, where Tom Myers will personally kick off this transformative professional training. Learn more at anatomytrains.com/ATSI. Massage therapists know better than anyone the healing benefits of bodywork are not just for a lucky few. Rather, massage is for every body. ABMP's Massage is for Everybody Week, celebrated July 19th through 25th, is part of a bigger year-long movement grounded in advocacy, awareness, and inclusion. Join ABMP in celebrating the powerful benefits of massage and the meaningful role you play in your community. Together, we're helping to expand access, support underserved populations, and elevate the profession with compassion and professionalism. Learn more at abmp.com/massage-week.